Hi, it's Catherine McQuaid from Trust Robin. We are a patient and clinician education group, and we work both in video and in app-based materials. We have specialties in wound care in clinical sense, because that is Robin Mossing's background. He's the founder of Trust Robin. And we're looking right now at our digital partner's welcome screen. Our digital partner is IMD Health, and we're going to walk through together today 3 different use cases of the education library. One is the physician-clinician, and this is maybe a patient visit or materials that you would also send to the care team for that patient and their family. The second use case is a consulting or retail pharmacist. The consulting pharmacist could be on site in a facility, a healthcare facility. They could be in a home care setting doing medication therapy management, for example. And the third use case is the community pharmacist, and this could be in a retail store location, or it could be in a hospital pharmacy. So since we are at the welcome screen, I'd just like to point out a couple of elements that make this such a wonderful way to get information into a patient and a care team member's hands. The first is navigation. You can see that there is a little icon here, educate a patient rather. This means that, and I'll walk through a case together with us so you can see that in detail. But know that when you are in a consult or you are a pharmacist on the retail pharmacy floor, for example, and if you don't have access to a desktop, this is all mobile-based. So if you were doing a consult or a quick treatment or diagnosis conversation, you could use the Educate a Patient icon, and the little body with those dots on it indicate that you could have the experience for the patient all be relevant to the part of the body on which that complaint is presenting. You would also notice that there are health topics and health associations. This tells us the source for many of these materials, and it also lets you know that these have all been reviewed. They are both medically and clinically compliant. I am, by the way, showing you right now Canadian materials in English. If you're in Canada, this is all in French as well. And for our American partners, there is the Mayo Clinic and other materials provided that would help you know that you can be comfortable in sharing all of this with patients and other healthcare providers, as well as families, because it has been reviewed and approved. The third element that is interesting here is that the home screen can all be customized and set up for your use or for your institution's use. You see right away that it's branded. This is Trust Robin. That's our logo. And if you were to look down further, you'd see that when you first sign in or when you are a brand new user, this is all very easily self-guidance on how to use the platform. It's designed to be a on the go and in the store, and the pharmacy technician from the person at home can all have equal confidence that it's easy to use and manage. So let's look together at the first use case, which I mentioned, which is the physician and the clinician. So let's imagine that this is a situation where you are doing a consultation. You could be the pharmacist as well. There's a bit of overlap in how the materials are used, but for the moment, let's assume that you're a physician or clinician, other healthcare provider perhaps, and you are involved in a patient visit. We'll go in and I'll show you how we have set up so it's very easy to get these materials at the end of that discussion or that meeting be distributed easily. Let's just assume that that we have a female patient. I'll put in my email address just so that I can show you at the end how easily all of this gets sent off. You'd put in other email addresses if you were sharing it with the pharmacy or with the rest of the care team. And now you are in the screen where from here on in all of the documents that you open will show up in that email icon list, meaning that they will all be automatically attached and they are therefore ready to go at the end of the discussion. So I mentioned that you can set up shortcuts, whether it's related to cases that you see a lot or your own specialty or materials that you have experienced as being especially useful in certain situations. So here's my series of shortcuts. I have them put under disease states or topics. Because these are the ones that relate most often to the kinds of circumstances in which I would use them. We also notice that there are organizations that I've selected that have things that are useful, or they are disease situations or care suggestions that are pretty widespread. And you can also, at the bottom, by the way, here's our stuff, and probiotics is a very interesting topic. You would be able to find that and send that along if you were dealing with somebody who had digestive concerns or perhaps had medication, adverse responses to medication. Also treatment responses. And so you can see that there is a very complete way for you to get the materials organized for yourself so that you're not rebuilding your list every time. So this is a patient that, let's say this patient is a diabetic patient. And let's say that the patient just generally wants some guidance. You could choose to go and find these documents in terms of the patient's presenting symptoms, if that would be perhaps a really nice patient experience. But you also want to notice that there are other topics. They're organized in terms of systemic topics, and they are going through all of the list in a way that will allow you to find them by well-known means. You can then, if we said this was going to be diabetes, so we'll look for the diabetes subcategories, and I'm going to, there's obviously all the other related symptoms, secondary conditions related to diabetes. So I'm going to assume this is a type 2 diabetic patient that we're seeing. And we've talked before with the patient about risk factors, but today they're bringing some complication questions, and because we are skin and wound specialists, we'll assume that it's a skin condition that they are presenting with, and we'll look at some of the lifestyle conditions or lifestyle advice that we might want to have for them. Let's assume that they have not seen the Diabetes Canada guide. I'm going to, because they've mentioned that they get a little bit concerned when they're in a restaurant, I'm going to give them this to look at. It's got really practical ways to deal with finding the best choices when they're away from home. I'm also going to suggest that I give them the glycemic index materials, because that's pretty general, the kind of things that will help them make good choices as well when they're not at home. Now I'm going to go back to the type 2 diabetes overview again, and I'm going to choose the Healthy Grains Institute, because I've looked at this and I think it has wonderful information, as well as being beautifully produced and in real consumer-friendly, everyday language, along with some other websites that they can look up. We're going to go back then to type 2 diabetes. I'm showing you this so that you can tell that the navigation is very easy. Looking then at professional tools, going again to Diabetes Canada, because they have the pharmacological glycemic management topic here, and it's this patient is being treated for type 2 diabetes, and they have had questions about some a little more clinical information, because they've read up a bit now, but I know that I'm going to include this with the other caregivers on the care team, which includes the podiatrist who's treating this patient for foot ulcers. So now I have then 5 documents lined up in the email that I'm recommending that this patient also share with their family, and I've included the other caregivers. So we're ready to send this off to them, and here's the list of the materials that I'm recommending that this client have a look at. I'm going to personalize it because it's going by email. I'm going to send a quick message, and I'm going to also encourage this patient to send it to their family. I'm ticking off all the compliance information, and there it is. It's gone off to that team, and the patient can forward it to the family, so everybody's on the same page. Now, as a physician and a clinician in this environment, my objectives are that I am not just engaged in patient education, but because the documents are compliant and the documentation is being tracked for the patient reading it, for if you're in the United States, the QPP, the quality payment program related to MIPS. If you're in Canada, and you're a pharmacist, you'll know that there are incentives and quality outcomes improvement initiatives that this kind of documentation can support. It also allows me to integrate this with my calendar so that I can do an automated email follow-up, both to encourage the patient and the family to read the materials and respond with any questions they have. This is all about encouraging compliance and patient engagement, which we know contributes to improvement in outcomes. And the reporting is the documentation that will substantiate how this can help your patient treatment plans. So that is the first of 3 use cases, which is the physician and clinician using it as part of a patient care team. I'll also point to the fact that if you are a physician, that when you go to the IMD site, that you can sign up for a free account, and if you're an institution with several users, This is a hospital, for example, or a clinic. This is a